So, hi all, welcome to AETCM, the emergency medicine channel. So, in the procedural part, in the second part, today's I want to give a demonstration of peripheral intravenous cannulation. So, before getting into the procedure, firstly we'll take a flashback of that whole procedure. First, where I want to start from means introduction or the definition of the peripheral intravenous cannulation. What is meant by peripheral intravenous cannulation? So what is meant by intra? Intra in the sense into the vein. Okay, intravenous means into the vein. So how I can define means, so we are going to place a catheter inside the vein or into the vein for the purpose of to deliver the drug. So that is what our definition. So we are going to place a intravenous or we are going to place a catheter inside the vein or into the vein for the purpose to deliver the drug. So that is what our definition. So second thing, so one more thing here I want to add, it is one of the minimally invasive procedure. So whenever we are going into the invasive procedure, strictly aseptic precaution should be taken over. Then what is the, why we want to perform this procedure? So in definition part itself, we told for the purpose to deliver the drug. So we know a drug usually we will deliver through the two routes. First route is a parenteral route, second route is a enteral route. So in this parenteral route, your IV drug delivery is one of the method what we are following in the parenteral route. Then coming into third part, mainly indicated for the, so if you want to introduce any medications in this high some of the critical condition like cardiac arrest, or if you want to administer more amount of fluids, that we can go with an your IV route. And then main advantage in the IV route compared with an all parenteral route, here that onset of action mean the same time that bioavailability will be in a higher range. So that reason we can go with an IV cannulation. What might be the contraindication for the peripheral IV cannulation means, main contraindication we can tell based on the site itself. Means site wise, so if you have any local limb injury or ischemia related, vascular related ischemia is there. Second thing, if any problem in the nerve signaling, like the person have a like paralysis or paresthesia or limb weakness means, there we have to avoid that site we have to avoid. If person have a one side means you can choose the other side of the cannulation. Okay, these are the some common complication. And then if the person have any previously, if you prick the same vein means you can go with an other veins. And then if the person have any hardening of the vein or phlebitis is there means, there also we have to avoid. So these are the some common contraindications. So in a procedural part, we are going to divide into three portions: pre-procedural preparation, procedural part, and then post-procedural things we have to do. So first thing, pre-procedural preparation. So what are the things you have to do? First, before preparing all the equipments, you have to get into the person. You have to first you have to introduce yourself. You have to stand right side of the person. You have to introduce yourself, greet the person. Second thing, what we have to do, we have to verify the persons. So by the seeing the identification number, by asking the questions like a name, age, sex, those are the things. Third part, you can ask your aide to prepare the all the things. So whatever things you needed for the peripheral IV cannulation, you can ask your aide to prepare the things. Fourth part, what we have to do means, so we have to take the informed consent. So that is one of the important thing. So we have to explain like what is the purpose, why we are going to do the IV cannulation, what are the risks that is associated with that, and then what are the benefits by that the person will get. Finally, what are the like alternative techniques we have. So those are the things comes under the informed consent you have to take. And then finally we have to ask the aid to prepare the things, right? So what are the equipments, material list or equipment list we needed means, first we are starting from the cleaning things. So you have to start from the personal protective equipments. So here I have a gloves, and then you have to take the mask. So what are the things you needed? You can, if needed gown also. If some person universal precaution means, you can go with a double gloves, and then you can get the gown also. Then second, I wanna this one like alcohol swab you can take, or if you don't have means you can take the chlorhexidine or alcohol hand rub also you can take. Then here I have some cottons to clean the area, to sterilize the area. And then I have a cannulas. like we have a various type of cannula. We have a, this over the needle catheter cannula. So we have a various things, like it starts from the 14 French to up to the 20 to 24 French, up to 24 French we have. First here we have a four major cannulas. First 14 French is your orange cannula, and then 16 is your gray cannula, and then 17 majority of the setup or some of the setup they are using, that is white, and then 18 here I have a this one green cannula, and then 20 here I have that is a pink one, and then 22 here I have a blue color, and then 24 that is your pediatric size yellow color, and then 26 your violet. Okay, so these are the some various type of over the needle catheter, or we have a various type of peripheral IV cannulas we have. So what are the major things we have to remember in the IV cannula means, so whenever you are choosing the cannula, you should remember for what purpose I am going to introduce. Means, so that we started from the 14, right? So 14 to 28 we have a cannula size. So based on whenever the number is increasing, so 14, 16, 18, 20, 22, 24, 28, 26. So the when the number is increasing means your diameter of the catheter and then your length of the catheter will be decreased. Okay, so hope you understand, that is inversely proportional. So if the number is increasing, like 14 means the size and then diameter of the catheter and the length of the catheter will be in a higher side. But if you are going into 24, 26 means the length of the catheter mean the same time diameter of the catheter will be reduced. So for that, if you are going to, if you want to do a like a PRBC or some blood product transfusion means, you have to choose the, ideally you have to choose the larger size of cannula. Okay, so that is one thing. So if you want to administer more and more aggressive fluid resuscitation means, there also you have to choose the larger sizes cannula, like a 14 or 16, or commonly we will use 16 and then 18. So if you want to administer only for the fluids, in the sense mainly in the case of adult means, so you can choose the 20, that is your pink, or 22 blue you can choose. So mainly in the case of pediatric we will go with a 22 blue, or majorly 24 yellow or 26 violet is the common choice for the pediatric cases. So this is what we have to remember in the your cannula regarding things. And then here I have a 10 centimeter extension, and then here I have a 10 cc syringe to see the flashback, and then to see the verify that IV cannulation. So you can take separately, and then you can pre-filled like this. So pre-filled syringe you can take, and then here I have a puncture proof container, and then finally I have a documentation paper. So these are the equipment list what you have to arrange before doing the procedure on your hand side. So get into the procedural part. Before getting into the procedure, we have to comfort the person, we have to place the person in the comfortable position. Mean the same time your comfortness also most important. So if you want to rise up the bed means, you can rise, or you can sit in a comfortable position based on your preference. Then we are going into the next part, where we are going to insert the cannula. So as like I told, before inserting the cannula, you have to first you have to fix the purpose, for what purpose we are going to insert. Based on that you have to select your cannula, and then based on that you have to select your vein also. So if maintenance fluid means, you can go within some smaller veins like a metacarpal you can choose. So if it is like some irritant medication, or if you want to do a more aggressive fluid means, you have to go within some cephalic region or cubital region, anticubital region, that you have to choose. So or brachial region with the guidance of USG also you can go for. So based on that purpose you have to choose both catheter, and then you have to choose the site. And then what are the common sites regularly we are using means, so we have a metacarpal region. In metacarpal you can see that veins, and then you can see the cephalic regions, and then we have some accessory cephalic also we have, and then we have in cubital region we can choose. But in cubital if you are choosing means, majority of the time the catheter dislodgement or occlusion chances are there. And then you can go with a brachial region. If the person is skinny means, sometimes you will get the brachial region also. And then you can go with an in your neck, you have an external jugular vein, it's one of the region. And then if you are going into lower limb means, there in medial malleolus side we have a greater saphenous vein also is there, and then you have a metatarsal vein also is there. So those are the some common sites. Mainly will go with a metacarpal, cephalic, and then your brachial, and then cubital region. So those are the some common veins. And then so I make the person comfort, and then I already took the consent. Here I am going to perform the procedure. This is called the tourniquet. It should be flat and then it should be like elastic one. So I am going to apply the tourniquet. So first I selected the site. Here I am going to insert in that region, or you can go with a metacarpal also. So tourniquet, you have to remember in a tourniquet point that you have to apply 10 centimeter, or you have to apply 3 or 4 finger breadth above the insertion site. So that is the ideal location for your tourniquet. Okay, so I am going to apply the tourniquet. So you have to give a moderate pressure. That pressure will only occlude your arterial, or sorry, venous supply. So that is enough to occlude the venous supply. You should not give a more pressure. Might be it can occlude the artery also. So the minimal pressure I applied, and then you have to wait for the engorging of the vein. Okay, so engorging or bulging, when it will happen, so it is a passive circulation. Venous circulation is a passive one, so it will take around 30 seconds to 1 minute. So until that you have to wait. Or else what you can do means, you can hang the hand like that. So you can place the limb below the heart level. So because of that gravity, again there might be a chance of engorging of vein or bulging of vein will be there. Or in the third step, what you can do, you can gently tap over that region, or you can gently strike over that vein. So thereby also we will get a engorging of the vein, or we will get a bulging of the vein. So before getting into the cannulation, always try to go with a distal to proximal. Means if you are selecting the upper limb, means you can go with an your metacarpal to the your brachial region. Why? Means if you are first itself you are pricking the brachial, means if something phlebitis or if some hematoma formation happen, means so that will affect the whole circulation, or it will interrupt the whole circulation. That is why better you can go with an, or you try with an lower distal region to the proximal region. Again, one more important thing, you should not choose the creases, or you should not choose the joint region. So mainly in cephalic you can go, but in cephalic also more distally or proximally you can choose. So while inserting the cannula, okay, that is one of the thing. And then one more thing, while pricking the while inserting the cannula, you have to, the vein should be in a palpable manner. It should not be in a more harder one. Okay, if previously if you pricked, or if the person has on prolongedly he is on some antibiotic medication on the time, phlebitis, or if the person have a illicit drug usage, means there also there's some phlebitis or hardening of the vessel we can feel. So if you are feeling that hardening of the vessel, means then you have to definitely you have to avoid that vein. So by the time I can see that engorging of vein. So here before that you have to perform all your PPE. So you have to do the hand washing, and then you have to take the gloves. That is most important thing. And then here I took the gauze. I am going to sterilize the area. So how to clean the area? So I choose the vein of ear. So I have to go with a center to periphery. Okay, from the midpoint to the periphery, outer you have to go. So like this, in a circular manner I am cleaning. For with the first gauze you have to place in the kidney tray. Second thing, again I am taking. So I have to clean from the center to periphery. So likewise 1 or 2 or 3 times you have to do. So place it in the kidney tray. So likewise you have to take your cannula. So let it dry. You have to allow it dry for 30 seconds to 1 minute. So let it dry. Mean the same times we'll see the parts of this cannula. So I forgot to tell about things. So first here we have this outer cap is a protective cap. So we have a protective cap, and then here that you can see that introducer. So where two portions are there. So one portion, this is the your stillet like a portion, or this needle is a securing needle, or holding needle, or introducer, whichever way you can call. And then we have this portion is called the this hub, and then hub is attached within your plastic portion. So these all things are the sterile manner. So you have to keep handle in a very sterile manner. Okay, aseptic precaution should be done. So this portion is introducer, needle introducer. This portion, this plastic portion is your catheter, plastic catheter portion, and then the catheter, plastic catheter is attached with your hub of the catheter. And then here we have that marker, like which size. So that marker, we have cap portion, we have a marker, and then here you can see that this portion is called the stopper, okay, needle stopper. And then back side we have a flashback chamber we have, and then here we have a one more hub also. So these are the some things. And then this is called the butterfly wings. So this wing is called the butterfly wings. So once you take out the cannula, you have to take out from that your protective cover, and then you should not touch this plastic portion. This is completely sterile. So you have to take it out. You have to spread the first butterfly wings, you have to spread it out, and then you have to place your cannula like this in a triangle manner. So your thumb should rest over this back side of the hub, and then your two finger rest over this your butterfly wings. So this is the way you have to hold your catheter. So it should not be like this, or it should not be like this. So you have to hold in a triangle manner. One, your thumb should rest over this backside hub, distal portion of your catheter. Your two finger rest over this your butterfly wings. Okay, so this is the way you have to insert. And then we are getting into the procedure. So after the drying of the your sterilization part, again you have to verify, and then you have to go with an insertion part. So while insertion, what is the angle we have to maintain? So in based on, if you are referring in a book, mainly they will give a 10 to 30 degree angle. So for theoretical purpose it is completely okay, but practical purpose it will differ. Sometimes you have to go with an somewhat deeper, and then you have to reduce your angle. So that might be a 45 degree angle, that might be a 40 degree angle. Sometimes you have to more distally or more lesser angle you have to insert. So for your theoretical purpose you can remember 10 to 30 degree or 30 to 45 degree, but clinically it will be vary. Okay, so after insertion, so after setting an angle, so for it is a 90 degree. So if you are keeping cannula is the 90 degree, 45 degree means this one, 30 degree means somewhat you can reduce. So I'm carrying the catheter, so 30 to 45 degree angle, so or 10 to 30 degrees. So here somewhat I am maintaining the 30 degree angle. Okay, so give a lateral pressure. So if it is the vein is coursing like this, right? So you have to give a lateral pressure slightly. So mainly in the lateral pressure where it will help means, so that is for the to tighten the skin. So mainly in the case of elderly cases, their turgor will be somewhat less. There also it will be helpful for us. So give a lateral pressure, and then I am going to insert here. So it is somewhat 30 to 45 degree angle. So 30 degree angle. So once if you prick that area, you will get a flashback. Okay, in this flashback chamber you will get a flashback. Once if you got the flashback, you have to reduce the angle, and then you have to reintroduce the you have to furtherly introduce the catheter. So how it will be means, so first 30 degree angle, I am going to prick. So here you can see I got the flashback. In the chamber you can see the some blood tinging, right? So after seeing the flashback, what you have to do means you have to reduce your angle. So if you are maintaining 30 degree means somewhat you have to reduce up to 10 to 15 degree, and then you have to slowly introduce your catheter. So half of the thing you can partly withdraw your needle. Okay, the reason I will tell later. So partly you just withdraw the needle, and then you introduce that plastic portion alone until the hub. Okay, till the hub. So you have to introduce, and then you have to remove the needle. So this portion I am stopping here. So why we are partly withdraw the catheter or withdraw the introducer means, so if already we hitted on the vein, now we are inside the lumen, intraluminal area. Okay, so if you are going along with, if you are progressing along with needle means, there might be a chance of re-pricking of the vein, or there might be a chance of counter puncture of the vein can happen. So but if you are partly withdrawing the needle, only you are introducing the plastic portion means it won't damage any other vessels, or it won't cause any counter puncture things. Okay, that is why I'm partly you have to withdraw the needle. So while withdrawing with the one hand, if you are withdrawing means with the other hand you can introduce the plastic portion alone. So if you are going extravasation means clearly you can note you can see that resistance of the things. So if you are intraluminal means the catheter will pass more smoothly. So those are the some findings you can experience while the time of IV cannulation. So this is the way I have to, and then I have to occlude this distal portion. I have to remove that needle. I have to place in the puncture proof container. Then I have to take the pre-filled syringe. So here I have to attach, and then so you have to attach, and then you have to check for the backflow, then you have to introduce into the thing into that circulation. So before that you have to ask the person if they are feeling any pain or some irritation or something. So if it is going well, means, so you can again, so I can stop through this three-way stopper, and then I can remove the needle. So make sure your the catheter, you should not be dislodged, so you have to keep always one hand over the catheter. So you can ask your aide to open this IV fixer, IV dressing. So here, so while fixing the catheter, always remember, so at least one or about 2 to 3 millimeter, approximately 2 to 3 millimeter, that should be exposed to the outer region. Why I am telling this thing means, so sometimes because of that manufactural defect, that from the hub, the catheter, that plastic portion can detach, and then it can free float in the circulation. Sometimes it can the condition is called catheter embolism. So right, so for that, to prevent that catheter embolism, we have to place one your thing IV dressing over this region. That is why we have to keep at least 2 or 3 millimeter that should be exposed to the outside region, that you have to fix it off. Okay, that here I fixed it off, and then remaining catheter also, the portion also I can fix. So this is the way I can fix, and then I can, so now I anchored the catheter, I secured the catheter. So you can place your micropore over here, and then you can complete the procedure. So we fix the catheter. So before that, fixing everything, so once you place the catheter, so if you verify, so if you make sure that is in the inside, only in that your vein itself, and then before giving an your flesh, that bossy flesh, or you are giving the flesh, right, before that you have to remove the tourniquet. So that one point you have to add, you can remove the tourniquet, and then you can flush the line, and then you can anchor the catheter. We cover pre and then procedural part. Post procedural part, you have to remove all your personal protective equipment. Before that, you have to discard all the things in the correct waste segregation, and then you have to thank the patient. Don't forget to make the documentation. So that's the things that will comes under the post procedural part. So finally, complication regarding the peripheral IV cannulation. First, you can divide into local complication and then systemic complication. So what are the things that will arise in the local area, in a localized area, means there might be a chance of phlebitis, one thing, and then mistakenly you can place your catheter, or you can damage like nerves, tendons or ligaments, and then something like called thrombophlebitis, and then sometimes extravasation of the cannula or infiltration. Those are the things that can arise in the local area. And then coming into systemic part, if you are giving administering more and more fluid, means that is called the fluid overload, and then or volume overload can arise, or if you are doing any if you are breaching any aseptic precautions, mean that can cause the some infections related things. And then one more important thing, air embolism, one important thing, and then one more important thing is a catheter embolism. So these are the some complications that can arise from the your peripheral IV cannulation. So do your best. Shalom.